Well, and on that subject, our hospitals are approaching ICU capacity. 17's Eitan Wallace joins us now with where the figures stand, plus why a local hospital leader says this is no time to panic.
Hospitals across the U.S. and our region are filling up. As of today, the San Joaquin Valley's ICU capacity stands at just 1.9%, a dip from yesterday's 4.3%. But in Kern County, that number is higher, standing at an unadjusted rate of 10.6%, with a total of 49 ICU beds available across Kern's 10 acute care hospitals. Last week, Kern had 50 available ICU beds.
Kern's hospital capacity fluctuates every day. However, overall, the stats illustrate our capacity is decreasing.
Decreasing, says Kern Public Health Assistant Director Bryn Kerrigan, noting these stats. Today, Kern hospitals are treating 225 COVID patients. This time last week, that figure was 187. 54 patients are in the ICU for COVID treatment. This time last week, it was 41. In total, Kern has 829 available hospital beds, a decrease from last week when we had 846.
Kern has been preparing for these hospital surges since the beginning of the pandemic.
Kerrigan points out county supervisors allocated CARES Act funding to bring in dozens of traveling nurses. As of last week, 28 traveling ICU nurses were added to the Kern hospital system. She also says the county is maintaining an alternative care site at the fairgrounds where an influx of patients could be brought should capacity run out at local hospitals. Kern Medical CEO Russell Judd says his hospital's intensive care unit is filled up, but adds only one patient in the ICU actually has COVID. Still, he says all of Kern hospitals are closely watching the numbers.
Yes, we see that the number of hospitalized patients is increasing. The narrowest neck of the funnel is the ICU, and an element that we are extremely aware of and concerned about. But I will reemphasize that we are prepared and are moving forward with those plans to be able to meet our community's needs. Now is not the time where we're at crisis. However, we do continue to encourage individuals to be safe, to avoid the spread of the disease so we do not get to that crisis point.
How often have hospitals come this close to ICU capacity? It's happened more than you may think. I'll have that at 6 o'clock. In Bakersfield, Eitan Wallace, 17 News.